Let me just check here. Well, we do have a quorum.
Did a third person log in? I just have the two of you still.
Carol Braun.
Oh, okay. Sorry about that, Miss Dr. Braun.
That's okay.
Oh, okay. Well, I will turn it over to you if you would like to. Go ahead and start, Dr. Bobrowski.
We'll go ahead and get started. It's and I don't know. I'm Dr. Garth Bobrowski and chairman of the dental TAC, and I don't know who schedules these meetings on a November day when it's in the 70s outside and sunny. We'll have to speak to somebody about that. I'll introduce our other TAC members is Dr. Phil Schuler and Dr. John Gray and Dr. Joe Petrie, which we're waiting on them to get online with us today. And our new members is Dr. Carol Braun. And
recording in progress.
And specifically when it comes to our interactions with the healthcare system, we want our healthcare
If you're not speaking, can you please mute? Thank you.
we want to welcome Dr. Braun, and I understand that she had been on the TAC years ago. And I know she's the dentist that runs the community dental clinic in Owensboro, Kentucky. So we want to welcome you, Dr. Braun, to the TAC, and we want to make you welcome, and please feel free to chime in and ask questions at any point in time.
Thank you.
But we do have a quorum for our meeting, so we will make a motion to approve the minutes from the August TAC meeting.
Dr. Braun, if you don't mind to turn on your camera while we vote, please, that would be great. Thank you.
I needed a second. Got a second? Okay.
Second.
Okay. Thank you. All in favor, say aye. Aye. Got it. Okay. Now we're going to go into some old business, and want to kind of we got a lot of questions to ask this today, and as you can see by the agenda and some reports too. But Commissioner Lee got a question: is the plan that's being brought out January the 1st of 23? Now, is that the same thing as the basic health program? Is that kind of if you want in the new adult dental codes, is that all in the same plan? But if you don't mind to give us some information on that, I appreciate it.
Yeah, thank you for having me, and welcome, Dr. Braun. Glad to have you back on the TAC. The basic health plan is different from the new benefits that will begin January 1st, 2023. The basic health plan is a result of a recommendation from the benefits task force, the benefits cliff task force. What that task force was charged with was looking for insurance options for individuals who between the ages of 18 and 64 who no longer qualified for Medicaid due to an increase in income. So a basic health plan would be a health plan that is between Medicaid and the qualified health plan on our state-based exchange. It would just be another option and a cheaper option for individuals to maintain health insurance. So that's what the basic health plan is. So the new adult treatment codes that'll be coming out and be effective January 1st, 2023 relate to fillings, crowns, and dentures, and an extra cleaning per year for adults. Dr. Brabowski, I think some of the research that you've given us and the discussions in this TAC show just how important dental health is to adults. And in Kentucky, we've mainly just been pulling teeth for adults. We've not been doing any of the restorative work. So beginning January 1st, 2023, there will be new services that are available to the adult population.
Well, we want to thank you very much, and I know probably a few years back that the TAC had discussions of seeing what we could do to help folks get back to work and smile.
Mm-hmm.
And we appreciate you all listening and trying to work out something to help people's self-esteem. And so that they don't have to talk like this all the time. And, it is embarrassing to have your, teeth missing and stuff, especially your top front teeth. So we look forward to, getting all the details on all this and working together. So we appreciate you all working on this, listening to the TAC. And I know, and we've had this talk before, that sometimes the wheels of government work a little slower than sometimes we'd like for it to do, but there's a process. And I know Commissioner Lee has worked with us in the past and took a little break and back with us now. So and I also want to commend her for working with the Dental Association. We have a phone call just about every month, and we talk about good things, bad things, and ugly things. So, but we've got to try to work some of these issues out, and we appreciate the MCOs working together to, just get a better health outcomes for the people of Kentucky. And that was kind of why down in new business, and I'll highlight it just now, but that C2578 study kind of alludes to, just like for diabetic patients and doing care for all of our folks. But now the basic health plan, that's what starts January of 2024, from what I understand.
That's the target date that we have. We're still exploring, what it would look like because it's not, it would be administered through the Medicaid program, but it's not a Medicaid product. It would look just like the qualified health plan, and the members would have to pay a premium and that sort of thing. But it wouldn't be a Medicaid product.
Okay.
So there's still a lot of details to work out.
Well, and I've talked to 2 or 3 people here this week, and it's kind of like when you all are adding in these other codes and stuff, it's kind of like part of a dentist's responsibility. I think I use the term of, I still like to play Legos with my grandchildren, and building a smile is a building project, and you've got to have a good foundation, or those Legos are going to fall over. And it's just like we got to work out some of the details on the partial dentures or crowns and stuff like that, so that we get a long lasting product of oral health care for our patients. Because what I worry about is, it's like when you buy a car, sometimes the salesman doesn't tell you about the maintenance part of it, but that's kind of up to your, either your insurance or yourself. But, those are things that we need to talk about with our patients of, how do we take care of this? And how do we make it last longer? And one of the basic parts is just those cleanings, coming in for those checkups. And those of us in the dental field understand that, but we've just got to keep working on getting that information to our patients to help them make things last longer. Okay, any other comments, Commissioner?
No, I just, want to thank the dental tech for all of the hard work they do and for the, treating the Medicaid patients and being, dedicated to our members and looking at ways that we can improve the program. We appreciate your partnership and the recommendations that you make that are leading to a better healthcare delivery system, particularly around, the dental benefits. And we just, want to keep working with this partnership so that we can move forward and improve the lives of those we serve. And we do appreciate you all.
Well, thank you so much for those comments. And another question, I think we had brought this up before, or sometimes I'll may have something on the agenda and we just run out of time and I don't get to all of it. But if you need to look this up later, then you get back with me, that's fine. But what is the capitation rate per dental patient?
But we pay the managed care organizations $1 per member per month payment, and it's supposed to include all dental and physical health services. I'm not sure that there's a specific dental MCO capitation payment, but I will go back and check with my finance folks to see if there's anything specific to dental.
Okay. See, we're all learning. We just got to figure out things in what's the old saying, in curious minds ask a lot of questions. That's not the exact phrase of it, but I guess that's, we learn by asking questions. The next old business is Dr. Julie McKee was going to give us a follow-up report on her survey. So Dr. McKee, I'll turn the floor over to you for a minute.
So someone's going to have to allow sharing of my screen, please.
Should now be a co-host.
All right. I'm not nearly as up to speed on Zoom as I am Teams, so give me a minute. Can you see the screen? It's a PowerPoint presentation.
Can't see it yet.
Nope.
All right.
Oh, there it comes.
There we go. We can see it now.
Okay. All
Yeah.
right. Once again, let me see if this will, I may really wreck things, but I'm going to try something here. Okay, it didn't work. That's fine. Oh, there it goes. Can you still see it?
Yep.
All right.
Yes.
Let me, that's still not going to do.
I
I'm
think
going
you're
to
gonna
go.
click on enable editing on that yellow thing on the top, and then you'll be able to switch it to present. Yeah, there you go. And then switch it, your little, there you go.
All right. I don't think that still did it though. That's quite all right. We will continue and just pretend it's a nice professional presentation. We'll still get through it. Okay. When we presented our stuff before, our survey before, we had a lot of interest in it. I appreciate that. It makes us feel like we're trying to answer some questions that we all know. But one of the questions you all ask is like, could we see the specialty breakdown for these? And so that's what my few minutes is going to be, is the specialty breakdown on what we're seeing and how it compares to general dentist. There's nothing really eye-opening to me about it, but there are things like, yeah, I saw that coming. So we're going to go ahead and start and just go kind of through the questions as we did with the other one. Okay. Our question was practices that accept Medicaid. And we can send this to you all in case it is too small for you all to see. But we have it broken down is Do you accept Medicaid? Does your practice accept Medicaid? And if you remember, we were surveying practices more than the actual dental licensee themselves. So across the board, you can see the different specialties: anesthesiology, public health, endo, general, oral surgery, pathology, oral surgery, pain, ortho, pediatrics, perio, pros, right there. And you can see that they accept Medicaid. And when you look at the general dentist, 40% accept Medicaid, the ones that responded, and 60% or no, yep, 60% do not. And ones that we thought would be 100%, yeah, pathology, that's usually university related, oral facial pain. When you get into ortho, 58% accept Medicaid, 42% do not. Pediatric dentists, high five on them. 93% of the ones that answered our survey accept Medicaid. And we know not every pediatric dentist responded, but this is kind of what I see across the board, very high participation rates. Periodontics, a specialty, a little bit half and half. Prosthodontics, as you would expect, maybe until January, is quite low. Okay, so we took the people who said they do not accept Medicaid now, they do not, and we asked them, did they ever? And if you look across the board, I think this is kind of interesting, is the ones that answered no, I do not accept Medicaid now. Two in public health said no, they never did. Endodontics, 2 that said no, 100% said never did. General dentist said yes, they used to take it, but they don't, but 65% said no, we never took it. Thought it was interesting with the surgery. 75% said yeah, we took it one time. 25% said no, but they never did. Ortho, that's expected. Pediatric dentistry, I thought it was interesting because the 6% that said no, and there were only 2 of them, one of them took it at one time and one of them never took it another time. Perio and pros, we expected to see that. What MCOs do you accept by specialty? And this is not really all over the place. This is pretty good coverage, actually. We can see that we have high MCO participation in endo, general, surgery, and ortho and pediatric dentistry. And then it kind of calms down with periodontics, public health, anesthesia, and then we get the low ones, which we expect prosthodontics, yeah, and pain and pathology, that they only accept 1. What I see anecdotally across the state are geographic spreads. You'll see some places in Kentucky that are very heavy in passport and less in others, but then you go to another geographic area and you see well care being the prominent one. So it's a geographic, and I can't explain that, but I bet the MCOs could. But we've got most specialists accepting most MCOs. Age range. This one is a bit hard to read, but if you look at it, you've got colors of ages. Green are the very young, blue come on up to 13, 14 to 20, 21 and over. And you see the age ranges that they see. Let's look at general dentistry first. That's right here, the second one down. And you can see that they have age ranges that they take. The adults, about 84% of general dentists will take adult patients. High five again, because it's sorely needed. But you can also see in general dentistry that they're more likely to take the what I consider young adults. When I was 20, I was not a young adult, I was grown up. But the 14 to 20s, and then it decreases as the child gets younger. When you skip way over to pediatric dentistry, of course, they're not going to have a yellow line because they don't, well, the very, very few 21 plus don't even, they don't even show up on the radar. But pediatric dentistry shows that they are serving the 6 to 13-year-olds and the under 6. So they're taking up some slack here. I thought that was really interesting. Let me back up over to surgery, the last one here. I think this is pretty fascinating, and I can make a terrible assumption. Well, it's not terrible, it's just not scientifically based, is that they take, most of them will take about 70% of them will accept adult Medicaid for services. Fewer see that under 6, about 55%. But it's interesting, they are ready, willing, and able to see the 14 to 20-year-olds. So what usually happens in the years 14 to 20 that need oral surgery services? Third molar extractions. And I don't know if that's all of it, but they may be the ones that have the greater need. So let's see this one. Medicaid patients seen per week by specialty. This is not a percentage, this is a number. How many Medicaid patients, if you take Medicaid, of course, how many patients do you see a week? It's really interesting because the prosthodontics, periodontics, that's hard for us to say that that's statistically significant because we only had 1. Endodontics, only 3. Anesthesia, only 1 response that takes it. But if you look at some of the bigger providers, that the surgery, the oral surgery right here, almost dead center, it's really interesting because 42% of the practices saw between 30 and 60 patients, and 30% of the practices saw 61 plus. That's huge. Those are busy offices there to see them. Ortho, you can see where they're seeing a whole lot of patients in their Medicaid panel. Pediatric dentistry are seeing, the vast majority of them are seeing 61 patients, 61 plus patients a week there. Thought that was kind of interesting there. Dental specialties, misspelled, I'm sorry, currently accepting Medicaid patients. 100%. Everybody said, yeah, 100%. Now, you got to remember, anesthesiology only had 1, endo had 3, perio had 1, and pros had 1. But the ones that answered are accepting. The blue that you do see is general dentistry, is almost a quarter of our general dentists that currently provide Medicaid are not taking new patients. Pump it up over to the ortho, it's 6%, only 6%. I thought that was kind of interesting. And pediatric dentist, only 5% of those that responded told us that they were not accepting new patients at this time, new Medicaid patients at this time. Age range of their new patients by specialty. It gets kind of wonky and boring at this point, and this is my last slide, so we'll move on. But it's really interesting because we see a little bit of a shift, especially in pediatric dentistry, on what they're seeing in their new patients. Pediatric dentists are not seeing near as many new 14 to 20-year-olds as they had in that previous slide, but they are seeing the very young children, that under 6. So another high five for pediatric dentists. General dentistry is kind of all over the map. Once again, I personally like seeing the new patients being between 14 and 20, because so many times that age range is a huge dental abyss. 14 to 20-year-olds are making their own healthcare decisions about, are you going to go to the dentist? I'm not going, And whereas the 5-year-olds, the parents are like, guess where we're going today? So that is a good sign right there. The surgery, once again, the new patients are, many of them are that 14 to 20-year-old range that we see, and a little bit more in the under 6, but not that much more. So these graphs match the questions we ask in our survey. What we presented to you all last meeting. Lindsay Metters presented to the primary care TAC, and I thought that we got some really interesting feedback. And one of the things that one of the attendees picked up on, which I thought was really, really interesting, is the dentist perception of barriers to seeking their care from their patients was not getting to the dentist office. Barriers to reach the dentist's office was way low in what the dentist thought was. But then we also had a concern of no-shows. We've got too many no-shows going on. And her question was, are y'all calling these people to see why they're not coming to make their appointment? And I think in the private practice, the answer is probably not. So, but in a primary care setting, FQHC style setting, they may do that as a natural follow-up in order to be a better comprehensive case management of that patient, to see that. But I thought that was an interesting take on how they saw our study. So, got any questions?
Hello, Dr. McKee. This is Nicole with Avisis.
How are you?
Good. How are you today?
I miss seeing everybody
I know.
in
Turn my
person. I really
camera
do.
Me too. I hope to see you soon. Can you share with us how many providers were included in the survey, and specifically in regards to the specialty types that were included?
Yes. If you want to go to another subject, I can pull this up.
Okay.
Let me, because that was just on yesterday's. Let me see what I got. I can tell you we had a 12.5% response rate. I can tell you that. And PowerPoint. Let's see what we got. It was distributed to 3,140 dentists. We had 391 respondents come in. And then of that, I'll have to get back to my other presentation. We can count up how many specialists responded. The specialists did not respond in the same rate general dentists did percentage-wise, but they did for pediatric dentistry and they did for oral surgery more than the others, to be honest about it. But I can't. Sometimes I think I want 3 monitors and then I'm like, no, I really don't.
I don't know how we used to work on one monitor. I don't know how we used to do that.
How did we do that?
I don't know. I don't know how we existed before debit cards.
Isn't that the truth? Okay, so 11, 19, 270, 283, 284, 294, 299, 300, 336, 365, 371. Right there. So take out, well, there should be more in there. I miscalculated. Take out 267 from 391. And that's hard for me to do on a Friday afternoon. So that's 720,
Minus 267, you said,
264.
or 264?
Mhm.
Okay, so it's around a
Mhm.
371 minus 260
Yeah, that's
is 107.
okay.
So you had 107 specialty.
127.
127 I have.
Yeah.
Okay.
So that was our response rate. So the thing is that was probably what 15% of our total responses.
Okay.
Dr. McKee, this is just a comment that, you had a reduction of the 14 to 20-year-olds at the pediatric office.
Mhm.
One of the things that I'm hearing is that several of the pediatric dentists are, once a child gets to 14 years of age, the pediatric dentist is trying to move them on back to their GP to make room for more of the younger children.
I think that's appropriate, of course, depending on the caseload,
Right.
not the caseload, the patient panel. But I think that's right. But I also think they're retaining a lot. And parents drive a lot of this bus. It's like, no, she's got to come back to you.
Yeah. Does anybody else have any questions or comments on Dr. McKee's report?
Yeah, this is Dr. Schuler. Interesting. It looks, if you look at the results about who's seeing new patients and how many patients people are seeing, I can tell you from my experience that it doesn't necessarily match up with what I'm seeing, kind of in the real world. We can't get a patient into an endodontist, in Jefferson County, period. Not one. And they won't see kids, which is a challenge, always has been a challenge. Oral surgery is, we don't have many oral surgeons, in Jefferson County or the surrounding areas that see Medicaid patients. I'm part of a large group. We've got 144 practices, and our surgeons will see, referrals from our doctors, but they don't. In Frankfurt, we have a practice. They see a fair number of outside referrals, but in general, the oral surgeons, it's difficult to get in. It takes months and months and months to get an appointment, and there's very few of them that are actively participating. So, I'm not discounting, your results. People fill the surveys out and they put in there what they put in there, but to some extent, I'm not seeing that translate into what's actually happening out in the real world. So I don't know what to make of that, but
And the thing is here's the nasty about doing a survey is you have to collect the data you get. You cannot fill it in. You can't
Right.
say. And anecdotally, when I talk to dentists and I talk to systems throughout the state, I'm hearing a whole lot more about what you're experiencing than what our numbers showed.
yeah.
Absolutely.
Why would somebody if you were asking me a survey, there's nothing on the line. You would think people would answer it honestly, but when you've got providers telling you that they're seeing 60 plus, Medicaid patients a week, on a 5-day week, it's 10, 11, 12 a day.
Mhm.
I don't know. It's just maybe their impression is that they see a lot more than they do, and didn't really go back and count them.
I think you're right. And the other thing is you have to remember too, that only 12.5% of the dentists responded to this.
Mhm.
Statistical standards for epidemiological studies like this require it to have at least 15 to 18%, depending on the type of survey you're doing. Sometimes it's 20 to 22%. So I will never call this a representative sample of Kentucky dentists. It was just a point in time with the dentist who wanted to answer. And like I said, my anecdotal ears hear more of what you're saying. I am incredibly concerned about the oral surgery situation, incredibly concerned. Incredibly concerned.
Well, I mean, even with endodontics, I mean, I have been told by people in the MCO world that, they would pay the endodontist full fee to see to see a Medicaid patient,
Mhm.
whether that's on a limited basis or, just kind of a
Case by
broad
case.
stroke.
Mhm.
But they can't even get them to see them, at full fee. And I can tell you right now, if you were offering general dentists full fee to see Medicaid patients, we would not have a provider issue.
Right.
I mean,
Right.
even you hit us at a PPO level. I mean, not even UCR, but just PPO level,
Yeah.
which runs 60 or so percent
Mhm.
of our UCR payments, and you'd have dentists coming out of the woodwork wanting to see Medicaid patients, which would make me very happy.
Mhm.
But that is certainly not the case. So I don't know. I mean, it's an interesting study, and like you say, I mean, the number, you get what you get, with these types of surveys. But again, I don't think that's really translating into the reality that we're living.
No. And we never meant it to. Now, if we had a 56% rate, I'm going, we are, but maybe I'll come up with some type of grant program to offer $25 Amazon cards when you fill it out.
It probably wouldn't take much to get a dentist to fill it out, but $25 would probably do it.
Yeah. I do it.
Yeah. Well, anyway, thanks for doing it. I know it's a lot of work doing these, and we appreciate the data.
We hope that this is the last time we do it. We like to do this on a regular basis, and maybe you'll catch some steam as it goes on.
Well, thank you, Dr. McKee, for that report. And, that gift card that'd buy a couple of lunches maybe. So that'd be good. All right. Is there any other old business that needs to be brought up or that I've forgotten? Okay. Go to new business. I want to jump down to number 2. We had the Kentucky Dental Association at our annual meeting had a Medicaid forum. I'll just give a brief report on that. It was Commissioner Lee came to, we had our meeting in French Lick, Indiana, which was a little bit of a drive for a lot of folks, but not too bad. But she came and spoke at our forum. Dr. Jerry Cottle gave a report on opioid use, substance abuse, and Dr. Adam Rich gave a report on antibiotic pre-meds, I think especially for joint care. And so, dentistry is, part of the team, and we've got to do our job with other health entities, whether it be drug related, either with abuse or getting all the orthopedic surgeons to agree to what do we do for this antibiotic pre-med, because it runs the range of zero information from the orthopedic surgeons to their patient up to the orthopedics say, well, you're gonna, every time you go get your teeth cleaned, you have to be on an antibiotic. So it's just a wide range out there. But those were some good reports at the KDA meeting, and for those, I believe everybody, all the MCOs were represented, and we got some reports from them. A couple other questions. Let's see. Get to my paper. One of the questions that I had, and this is maybe directed to Commissioner Lee or for any other for folks from Medicaid. It's like I know we and you picked up on it with your early comments, was that you were listening, to comments that were talked about or discussed at our TAC meetings. But we I guess, didn't get any direct questions as I guess as an advisory committee in the development of this new Crown's expanded services, I guess we'll call it. It's just, well, who came up with the codes to allow, who came up with the fees to charge, and then another question will be like, when will the dentists know what the fee schedule is going to be for those new added codes? But it like you said, or in the early part of this meeting, they were listening to the TAC comments and TAC questions, and again, that is very much appreciated, because it, like I said, the wheels of our government take a little time, but it came forth, because we had talked about that before, about getting folks work ready, and I think this is a great avenue to start with. And so, Commissioner Lee, have you got any top thoughts on that? Or
Yeah, I think starting out, we definitely want to get people work ready, as you said. And starting out, we thought, we pull teeth all the time. So what can we do? What are some of the things we can do to help people save their teeth? And that was, of course, the root canals, crowns, dentures, that sort of thing. So we started out small with those few services. The fee schedule, that our children's fee schedule is higher than our adult fee schedule. So the services that we're going to be adding, we're going to add also another cleaning per year for the adults. The fee schedule will be based on that children's fee schedule, that has the higher rates on it. So we'll be getting together those new procedure codes and sending them out to the TAC, so you all can look at the codes that we'll be adding, and make sure that we have the correct codes on the list for going forward, beginning January 1st of 2023.
Okay. Did any dentist or advise you on any of these things yet, or? And I know you've been listening to all of us and our conversations on our monthly calls and stuff, but on protocol for these new features or new additional codes, or?
No, but we will have input from the TAC when we get these codes. We will send them out to you and get some input moving forward to make sure that we're going in the right direction. But again, the overarching goal was to add a few services for adults, so that they would be able to keep more of their teeth, rather than us paying for it. And that's one thing that we have heard from this committee and from other dentists across the state is that the Medicaid program will pay to pull teeth, but we don't pay for any restorative work. So we just thought, with the root canals and the crowns, that definitely is more restorative than pulling teeth.
Well, I think that's great, because sometimes in order to build a smile, you've got to have that good foundation, and you've got to have those cavities fixed and the gum disease somewhat under control before you want to start adding a bunch of more expensive crowns or partial dentures and things like that. So I think that's great that you're looking at the whole package and helping us build those smiles.
And we think this is just the first step to start reforming. I have heard from some other dentists since we made this announcement. I don't know that all of them are part of the TAC, but they are dentists, Medicaid dentists, and I'm gathering some specific recommendations that I want to present to this TAC about looking at certain codes and adding this one, or maybe stopping one code and doing this. And so I'm going to gather some of those recommendations so that this TAC can kind of look at them and advise us on moving forward with some of those recommendations and whether they make sense or not. So again, expanding the services for those adults to keep their teeth, to help them with the restorative, and and build that smile, as you said, Dr. Brabowski, is that first step, but we think that there's more that we can do to not only improve the dental services for the adults, but for all combined, all of our, children and all, but we think that there's more things that we can do that might reduce a little bit of administrative burden on the providers, and start looking at some very specific codes and how they're used in the program. And is there a way for us to make improvements by, again, by eliminating some codes, expanding others? So that next phase will be, we'll be presenting some stuff to the TAC to look at and to kind of consider and talk through.
Okay, great. Thank you.
Garth, I have a question. Can I
Yeah.
address a question to Commissioner Lee? So these new codes are supposed to go in effect January 1 of 2023.
Yes.
That doesn't leave us much time to have any back and forth. It's only a couple of months. So there's that. The other thing I would comment on is, I mean, we do, so there are preventive, and if you hear jingles in the background, sorry, I've got 3 dogs running around here. Preventive is covered, diagnostic is covered. Seriously, right now you're going to come. Go. Diagnostic covered, fillings are covered, and extractions. Prosthetics, so dentures, partials, crowns, root canals, those types of things, are not currently covered. But up until this point, there's, when we're looking at adult fees, the reimbursement is low, and there's no lab fees attached to most of the procedures that are covered currently. When you start expanding into dentures and partials and these types of things, there are going to be significant lab fees incurred by the dentist. That is going to impact who is actually going to be doing these codes. Because, if we don't get the reimbursement levels up to a certain point, then again, with lab fees and, our fixed costs, which continue to go up, it's great that, we offer them, but, nobody's going to be doing them. The other thing is that, we're told regularly that, there's no more money in the till to increase reimbursements for the codes we already accept, whether pedo or adult or, kids or adults. So I'd be interested to know, where the money is going to come from for, to expand this out, because these are much more expensive procedures to cover, for the state than, fillings and extractions and cleanings and those types of things.
So as far as funding goes, back last General Assembly, Senate Bill 50 resulted in us moving to one single pharmacy benefit manager. And as a result of that, there was some cost savings that we think will be, we anticipate on an annual basis. That will allow us to pay for these additional services that are currently, they are services that are currently listed on the Medicaid fee schedule. They are limited to children under 21. Now, some of these codes will be applicable to adults, and we believe that this is going to help some individuals get work ready. For example, today I had a specific email from a dentist who sent pictures of an individual who had to have all of her teeth pulled. And he's a Medicaid dentist, and he worked with this individual and helped get a grant to get her dentures. And because of that, she was able to get a job, and she has subsequently moved off of Medicaid. So while we know that, this is a really good move, to help individuals and get them work ready, give them their self-worth back. We believe that the cost that we're going to use, of course, again, we've got those funds. We believe that the funds that we're saving based on Senate Bill 50 is going to help fund the services. And we just, hope that the dentists that are out there in the Medicaid program that are serving these individuals on a daily basis continue to serve them. And again, the fee schedule will mirror that children's fee schedule, which is higher than the adult. And again, this is just a first step in improving the dental program.
Can I ask another question about so for adults, are you moving all adult coverage to the pediatric fee schedules?
No, just the codes that the new codes that will be, or the additional codes that they'll be eligible for. We're going to start with those.
But the codes that you're adding are really not applicable to kids. So we don't do dentures and partials and seldom do root canals, on children. So there's not a lot of overlap, between the new codes and what we're currently providing for our pediatric patients.
We do know that we do have some pediatric patients that receive dentures. Unfortunately, the EPSDT, the Early Periodic Screening, Diagnosis, and Treatment Program, does pay for dentures for under 21, and we do cover dentures right now for that population.
Yeah, thank goodness it's not super frequent.
Right.
Well, thank you for your answers.
Commissioner Lee, I've got a suggestion. We've talked a little bit about the codes, and this is from the American Dental Association Code on Dental Procedures and Nomenclature. But one of the things that I've looked at that just in terms of reducing an administrative burden would be like part of this, like the foundation that I talked about was treating gum disease. One of them was when we do root planing for patients, we now can only get pre-authorizations for 2 quadrants at a time. This causes our front office staff got to double the work, to get this pre-authorized. And I just wish that we know what we got to do. I just wish that the rules were changed back to say, well, let's get it approved, and just to save those extra minutes of time that it takes to our staff to do this, because they're doing twice the work. They're having to do a pre-authorization twice. So I would just recommend it, and we can vote on this in a little bit, and we'll have the floor open for our other TAC members to comment, but just to reduce the administrative burden. And then the other thing is that for maybe you ought to look at was, we just see a lot of patients, a lot of the adults with gum disease. And I've seen more patients this year, and it tends to be more of the young ladies, I'm going to say in the 20-year-old age group. They're over 21, so they're only getting 1 cleaning a year. But some of these ladies it's called ANUG, acute necrotizing ulcerative gingivitis. And it's nasty. I mean, these folks are coming in sick, they're running a fever, and gums are just a horrendous odor. And it's a treatment code D4910. And it's a periodontal maintenance code and this is again, most of the usual customary treatment is if you've had this root planing or deep cleaning, some people call it, done, it usually has to be done with anesthesia. So even the periodontists recommend it. Well, once that root planing is done, they need to come back within 5 to 6 weeks to just have a polish, to clean them again and reinforce their oral hygiene. And I know that the D4910 code is a code that's used for diseased tissue. Typically, your D1110 code is used for more just your routine cleanings or a healthier tissue situation. But I'd just like for you all to maybe look at that. And the same thing that falls into treating diabetic patients. And I'll refer to that in a minute on that C2578 study. And I'll tie this all together here in a minute. But these are just some of the things that, if we're going to really treat disease, and I know Commissioner Lee, you said a minute ago, what you all have added was the kind of like a first step. Well, maybe I'm starting to look at the second step. But it's just, I'm just trying to, we've got to make sure that these patients have got a solid foundation, you know, for us to continue to build that smile. Otherwise, you know, we could run into, we need to get these protocols where that, you know, we don't do something in a totally diseased mouth without fixing the disease first. Even though, yes, it's an approved code, but we need to make sure that these people can maintain it or get your money's worth out of it for you spending the money on it. Let's see. Does any other TAC member have any comments on those items? And okay, got another question for the MCOs and the fee-for-service patients. What can we get the number of patients that are assigned to each MCO and in the state program separated out? I know we've had some expansion over the last few years, but is there a way we can get just that basic number of how many have been assigned?
Yeah, do you just want a report that shows each MCO and how many members they have?
Yeah.
Yeah, we post that on the website every month. And I can send you a link to that. And if you need us, if you need us to start sending that to you on a monthly basis, we can do that too.
Okay. On that website, is that just the general, the cabinet website?
No, it's the Department for Medicaid Services website, and we have one specifically with statistics listed on it. I can send a link in the chat, and you all can pull it up on your computer. And if that's the type of report you want, then we can just make sure that you all get a copy of it every month.
Okay. Now I'm embarrassed to say that I have not looked at that site.
Well, that's okay. So it's kind of hard to maneuver around sometimes. There's a lot of information out there. Sometimes it takes me a while to find it too.
Well, sometimes, and again, I have this down on like even our Zoom meeting link, and sometimes I can get to it different ways. So I try to be more computer literate. But it takes a while for us gray-headed folks. But we've talked about this before, and through the TAC, and I'm just trying to figure out a way of doing this maybe in a graph form of the TAC. We've talked about it, about getting each MCO and fee-for-service, provider, if we could put the number of like the MCO number and the on a X and Y, like this, a graph line, X being the horizontal, Y being the vertical graph, and charting the number of dental providers in increments per MCO of, like 10 providers, 20 providers, 30, 40 on up, if you've got 100 providers, whatever, and then compare that to the amount of the paid claims in increments of 500, 1,000, 3,000, 5,000, 500, 10,000. And I didn't know whether we should ask that per quarter or per month. And the purpose of that is just to see how many providers are out there that do just $500 a quarter, or how many are out there doing 10,000 a quarter? If somebody can help me on, I'm not a analytics type person, but if sometimes you can get into analytics and it might be per month, might just be an overwhelming job and not really worth the time it takes to get it. And maybe once a quarter might be better to do that. But if somebody could help me on that part of it, and then what we'd like to do is just kind of start back with and compare the years of 2015, 2019, and 2022, just maybe to compare back to those 3 years. And the other question was, I didn't know, would 3 months give us time to have those to look at by the next TAC meeting?
Yeah, we can try to get that information. It should be, if we're just looking at, dollar amounts and number of dentists and that sort of thing, we should be able to get it within that time frame. We ideally would be able to get it to you before the meeting so that you could look at it and have any questions formed by the time the meeting comes up. Now, I just looked online, I found it, and the reports that are online show, it does show the total enrollment by MCO, and it's by region, so it'll count. I don't know if I can share my screen or not to see if this is something that you all, let's see. Erin, could you let me share my screen?
I just made you a co-host, ma'am. You should be able to share now.
Okay, thank you. Okay, can you all see my screen? Does it show?
Yeah.
So is this sort of the report? This report is from October of 2022. So this is the latest report, and you can see, and this is what's posted online, and you can see, for example, Aetna has 244,919 members, and this is all by region. Of course, those region numbers don't mean a lot to you unless you know where the regions are, but we could, get a map of the regions for you. But this shows every single, you can see Passport has 334,000, WellCare has 488. And then this fee for service are those individuals who are in 1915C waivers or long-term care facilities. And then down here is United. So is this the report that you would like to see?
Well, boy, now that I know where to find it, that's exactly what we need.
Okay.
Yeah, thank you.
Okay.
Yeah. That just sometimes it just helps to know where we're at. But on the claims paid part of it, I think if we could have, that by a little bit before the next meeting, we could just start looking at that. And I guess, and maybe I can send you some other ideas to talk about in the future, commissioners, on I see patients from 2 different groups, from traumatic brain injury patients and clientele. And boy, you just got to feel sorry for those folks, because I've got one of these guys he was a model, in Louisville. And boy, I mean, you just never know when you're going to have a traumatic brain injury to ourselves or a family member. And I would just like to maybe see if there's some things we can just help these folks with on just their oral health care, and not let them get neglected, not let them get just shoved under the carpet. And there are, as you know, with brain injuries, there's different levels of trauma, different levels of understanding on their part. But we'll work on that one for another day. But now, are there any other questions from any other of the TAC members? Oh, question on that one I was talking about, Commissioner, on developing that graph. Do we need to bring that as a motion to the MAC, or can we just handle that here?
We can just handle that here.
Okay.
You can just give tell us exactly what you want. And if, we could go back and look at the minutes or something, but if you could just kind of type it up in an email and get it to Erin, she'll make sure that we get that information.
Okay. I'll make a note to do that there. So,
Yeah, you can just send us a little request and email, and that
Okay.
way, because when you look at that data, that might spur other questions, and then that might lead to a recommendation after you look at the data. So just getting the data and getting the information doesn't need to be a recommendation.
okay. All right. Thank you. Now, I wanted to kind of open the floor also to any of the MCOs, if they had a report. And we didn't ask any specific reports of the MCOs for this meeting, but I'd like to just give you just 2 or 3 minutes or whatever, just to, if you have an announcement or something, that would be now to give it. And we'll start on the agenda. I've just got it listed kind of in a alphabetical order there, but we'll just start with Aetna.
Hello, Dr. Bobrowski. Thank you.
Yeah.
If I may share my screen. Thank you. Just waiting for the document to pull up here.
You should now be a co-host, Nicole.
Thank you. All right. Stop my video and share my screen. Okay, can you guys see me?
Mm-hmm.
Awesome. All right. So on behalf of Aetna, as everyone knows, Avisis is their dental benefit administrator. We've been administrating and partnering with Aetna for a number of years now. And Aetna has been one of our true partners in allowing Avisis or working with Avisis with our innovative programs. For our care transformation programs in 2022, we've been able to show significant increase in accessing to care, as well as improving overall services. The first chart that we have here is our school-based visit program. This is a program in which we are encouraging and ensuring access for our mobile units and also our providers that will go into the schools and actually see the children in the school setting. So you'll see here, 2015, we were under 100 members or 100 children that were treated. 2021, we're a little bit under 3,000. 2022, we're projected to be over 4,000, a little bit under 4,500. So that program, again, is improving overall care for the kids. And just as with our mobile providers, we do require that the providers that are going into the schools, they do have to be affiliated with a brick and mortar office to ensure that the child's full care is addressed. Any questions on the school-based visits? All right, we also partner with Aetna in providing office anesthesia visits. So basically, when a child needs services that normally would be provided at an outpatient surgical center or a skilled nursing or a skilled facility, as opposed to the child traveling to that facility, the provider taking a day out of their practice and going to the facility to treat the child. Instead, we assisted Aetna in contracting with the anesthesia group that will physically come into their office and provide the anesthesia services there in the office so that the provider can treat the patient in an environment where the child is comfortable and also gives the provider the ability to treat other patients so they don't lose a day at a skilled nursing, at a outpatient facility. And you'll see prior to the arrangement, there were very few anesthesia services being performed in an office setting. Now we are, for Aetna, just a little bit under 200 for 2021. And then for 2022, we're a little bit above, just under 250. So as we get more providers to participate in the office setting anesthesia services program, we do anticipate that this number will continue to rise. And then similar or right on in line, Dr. Bobrowski, with what you shared that Dr. Cotto presented at the recent KDA meeting. This shows basically a chart that shows the opioid prescription program that Avisis and Aetna partnered with together. In summary, Aetna shared with Avisis pharmacy information for a dentist that did prescribe opioids. And then we did outreach with those providers. The providers that had a higher level than recommended, we did, in addition to sending them a letter, Dr. Cotto also called and did education with those offices. And what we found is there a lot of that, I should say what Dr. Cotto found, a lot of the reasons for the overprescribing was really due just to education. And once the education was provided, and you'll see that the rates drastically went down. So where we were a little under 2,500 providers that were, 2,500 scripts that were over, now we're down to below the 100 line, I should say 100 mark. And I see Dr. Cotto's name, even though he's not supposed to be on today, but I won't tell on you completely, Dr. Cotto. Is there anything else that you wanted to add regarding the opioid program? He may have gotten off. Okay.
No, I'm here.
Oh, you're there. Okay.
Dr. Elliott's my deputy director's on, but yeah, this was a staggering over 90% drop in prescriptions written by dentists for greater than 3 days, which is the recommendation from AMIS and from ADA and CDC. So it was just a wonderful response by the dentists. Once we educated them that this is the standard of care now, this is what these our governing bodies and the Board of Dentistry also is recommending. And they immediately took it to heart, apologized, said, they were sorry, they were ashamed they hadn't kept up to date, and were contributing to the opioid abuse project and problems we've all faced. So from the first cohort, when we looked at that same cohort again, on the second data run, we actually had 93% drop. Now, we picked up a few new ones that weren't on the first run, and that's why it didn't look like that. But if you looked at the ones we actually contacted, and believe me, when somebody was writing 30 days of narcotics for one patient, they got a call from me, not just a letter.
Thank you, Dr. Cotto. Okay, Dr. Bobrowski, we'll turn it back over to you.
Okay, well, thank you for that report. That's good information there, and thank you for those efforts there. Anthem. And if any of you, the MSOs, if you don't have anything prepared, that's fine. I didn't really ask for anything. The TAC members didn't really ask for anything, but Ms. Lauren, you're going to speak to us?
I am, yeah, if you'll
Oh, wow.
allow it. I'm Lauren Locke, speaking from DentaQuest on behalf of Anthem. Just wanted to share some quick things that we've been doing lately this year. If I can. You're now a co-host. Oh, okay. I did send in a sheet, or I believe Jean did for me. I don't know. Anthem and Passport both sent me a little bit of information prior to the meeting, Dr. Bobrowski, and I'll have that sent to you.
Okay.
All right. So yeah, what I wanted to share was just a few things that we've been doing this year.
Lauren, we're just seeing you. I think you have to take yourself off video to present, if I'm not mistaken. Sorry.
I don't know. Can I share? Will it let me? It should. I made you a co-host. Oh, you did. Okay, perfect.
But I think you have to take you off of your video and then share.
I apologize. I'm not used to Zoom.
Lauren, if you're unable to share and you can
Right.
let me know which document, I can share on your behalf since you guys sent me your stuff early.
Perfect. Yeah. I had it named, it's just Kentucky Anthem Medicaid one pager. Is that still the name, Jean?
Yes, give me 1 second. I'll get
Yes.
it pulled up for you.
Thank you so
Perfect.
much. Appreciate that.
Yeah. So while you're going over that or pulling that up, I will just start with, so Dental Home, we launched that in October. It started. So basically what it is just that we assigned all of our members to a primary care dentist in their area. And it's based off of history if they've been to a dentist before. So we were not going to, change their dentist or anything like that. So if they have history there, we assign them there. If they didn't have a history, then we just kind of assign them to someone that's in their area that's close to them, that's accepting new members at the time. So just something that we wanted to do for the members, so that to help get them, kind of encourage them to get back into the dentist. Something else that we launched this year, starting in March, was the Dental Days events. So we partnered with Dr. Watson and his mobile unit, taking that around, really 2 units around the state and each region that we've done so far, and just servicing members in those areas that are having a hard time getting into the dentist. In some areas where we had not as many people show up, we were actually able to do some treatment on those. Some, like the Paducah area where we had a lot of people show up, we were able to at least get all of them exams, and did, I think, treat some urgent cases. There was some people that showed up that, they were able to get them some antibiotics and things like that. And we've had a few cases actually where they've had follow-up treatment and completed their treatment. So it's been a really successful event that we've had, and look forward to growing in 2023 and, to expanding, hopefully do even more of those. So it's been a really cool event that we've started seeing it grow this year. Something else that we've been doing to try to help with the network, we implemented a reimbursement rate for the oral cancer screenings and tobacco cessation education. So it's a $10 fee now for, or reimbursement now for both of those codes for, I believe the age is 12 and up. So any Anthem Medicaid member 12 and up that you do the oral cancer screening or the tobacco cessation on, that's a reimbursement for those. Also to help it try to, get some more oral cancer screenings too. So, and then of course the reimbursement for the missed and broken appointments. I believe we've always had that, but that's always helpful whenever we, get those and see, the numbers on those missed and broken appointments. I know that's a big issue. So that was just a few things that we've been trying to do this year to try to service our members and help out with the network as well. I don't know, Jean, if you had anything to add.
Nope, I think you covered it. Thank you so much, Lauren. Appreciate that. Did a good job.
Okay, thank you so much, Ms. Lauren. Humana?
Okay, that's me again. I'll share my screen again. All right. Oops, sorry, got the wrong document. Come on. There we go. Doesn't want to act right today. I apologize. Here we go. Okay, can you guys see my screen okay?
Yep.
Great, great. So Humana, as another partner that Avisis does work with, they also took advantage and allowed Avisis to assist with the school-based visits in the in-office anesthesia program, but we also were able to work with Humana on our urgent dental subsequent repeat ER visit program. So this is another care transformation program that we do offer in our catalog of innovative programs. And basically the purpose of this program is to reduce the number of repeat ER visits due to dental services. dental services performed in the ER. So as I stated, it is a true partnership. Humana does share with Avisus their list of members that seek services in the ER. We take those ER dental revenue codes, and then we do outreach to those members, encouraging the members to seek care and establish a relationship with a general dentist, as well as educating them on the importance of the preventative care, and then again, assisting them with scheduling appointments with a general dentist's office. We did find that of the 18% of patients in 2021 that were repeated visits, for 2022, we were able to get that down and just have a 3% rate of repeat visitors. So in other words, only 3% of the individuals that are going in to the emergency department for dental services are returning for a second visit. So it's one of the programs that we're really proud of, because in addition to saving cost, more importantly, it gets the patients into the general dentist practices where we need them, to ensure that it's not just care to get them out of pain, but it is care to improve their overall oral health. Any questions? Okay.
That's good information there about trying to decrease the emergency room visits. I know a while back I had a young lady after an extraction. Just of course she was a good smoker, and she said that well, it's just handier for her to go to the hospital and get her dry socket treatment than to come here to the office. It's, I guess she lived closer to there, but it's I'm glad you all are making those contacts with those members. That, well, you know, it does save the state and everybody some money just to, well, go back to where the work was done.
Yeah.
You know. Good deal. Good deal. Passport.
Hi, everybody. This is Kimberly Hughes. I did send over a presentation. I don't think we need to share it. We had kind of taken, can you guys hear me okay?
Yep.
Okay. We had taken away a little bit of some questions from the last meeting, so we just was really following up high level with, you know, what some of our additional benefits were for the last couple of years, you know, what our membership were the last several years again. And so we shared that with Aaron, so Aaron will get that over to you. And also we shared a little bit of what our current, some of the things that we, one of the things you asked last time was what education we are doing about getting folks to the dentist for regular checkups, not just when it comes to, you know, ow, my tooth hurts, or I've got an infection, you know, some kind of issue, but getting them there for their regular checkups. And so we included some of that we use on a regular basis, whether it be for education or, you know, we can print them out and, you know, use them at any of our community events, since we're finally able to get back out and do those again. And so I included those so that you guys can take a look at those as well. And we also did one of our case management department recently did a PCP training, and they include that as well, including, you know, letting the PCPs know the importance of talking to the parents and stuff about getting those dental visits in early and when to get those. So I think that's something important that we wanted to share with PCPs. So they did get that into that training. So.
And you said you sent that, did you send that to Aaron?
Yeah, we sent it over to Aaron, so.
Okay.
And I'll gather them all up and send them to you guys after the meeting. Nicole, I dropped you a message in the chat with my email, if you don't mind to send me your stuff over as well.
Yes. Yes, I'll definitely send it right after the call.
Thank you.
Thank you all. And United Healthcare?
I thought I saw Dr. Rich on. Let me see if I can.
Yeah, I thought I did too a while ago there. He skipped out on us, Adam, boy.
It looks like he's logged in. Maybe he's having a hard time coming off mute. It is Friday at 3:30. I know my computer is
know.
running slow.
Well, I know for a fact now there's a couple of the TAC members that are either have been working on it or are going to work on it is cleaning gutters out, the leaves out of gutters here today. So that's a
He
project.
dropped in the chat that he's here and he had to call in, so he may be having some issues with his screen.
There you go. I think I can hear me now. Can you hear me, Dr. Barat?
Yes, gotcha.
I apologize. I was pushing *9 instead of *6, and it wouldn't let me off the mute thing. But anyway, I just wanted to say, you asked if there was anything new. So our newest thing right now is we've converted to a new hub for claims, and so I'm going to let Tessa Heron, our provider advocate, speak to that real quick, and that's what's new for United Healthcare right now.
Hi, this is Tessa Heron. I'm the provider advocate with United Healthcare. We are so excited about rolling out our new Dental Hub portal. It's a better user experience for our providers. The process they follow in the platform are even more error-proof than they were before. Providers can make real-time changes and update to their data. We really wanted to encourage providers to register for the new Dental Hub and highlight some of the new features. A general email blast in September and October. Our Kentucky team customized the information to highlight some of the enhancements for our Kentucky Medicaid network. That includes general email blast with the letter and a Dental Hub flyer. We mailed the letter with the Dental Hub flyer, personal outreach to every location in the network to encourage registration and training if needed. And then we follow up by emailing them another copy of the letter and flyer. We encourage providers to join the Dental Hub weekly training that is an ongoing been offered. So in results, we're very excited about this new hub, provider portal hub. And any questions, let us know. Thank you.
Thank you, Ms. Heron. Is there any questions? All right, WellCare.
Okay, that's me again. Give me 1 second. And I will share my screen. Okay, can you guys see me again?
Mm-hmm. Yep.
Great. Awesome. So WellCare is another partner that Avisus contracts with in Kentucky. We have had a long-standing relationship with WellCare. So their numbers have a little more history for our school-based program. We started in 2013 with them. You'll see that the rates were very low, 2013. 2021, we were up to about 4,000 members that did receive services in the school setting. 2022, we are estimating a little over 6,000. It's a lot of children that are able to receive services. It ensures that they are getting that the exam that's required for children to enter school in Kentucky. And again, ensuring that they kind of have them at a dedicated spot. So as long as the child shows up for school that day, they're definitely going to receive their care. And just a friendly reminder, again, any services rendered, those medical records do have to go back to a brick and mortar office to ensure that there will be some continuity in care moving forward. The anesthesia program, WellCare is also participating with Avisis and Avisis Assisted WellCare and contracting with the anesthesia practice that is physically going into the provider's offices. Again, we're still working and trying to expand the number of offices that will participate and allow the anesthesiast to come in, because again, it does give not only the patient a comfort to receive services in a setting that they're familiar with, but it also frees up the provider's time, and that the provider doesn't have to do the traveling back and forth, and they can stay in their practice. We also have a few new initiatives that WellCare will be joining in with Avisis, the Modern Pain Management Program, which is the opioid program. We will start exchanging information with WellCare so they can also share with us the list of their prescribing dentists that have prescribed more than the recommended amount for opioids, and we will handle them similar, and that will send out the letter educating them on the current requirements, and then Dr. Cottle will do outreach to them also. And WellCare is launching a SDOH dental component to their SDOH program, which we're very excited about. And we will be assisting WellCare with doing the calls for the SDOH program and assisting WellCare in identifying members that are identified through the dental office, which just provides them with another avenue to outreach to more members. Any questions for WellCare? Okay.
All right. Thank you, Ms. Nicole, for those reports. Appreciate it. Is there any other report or anything on the fee for service or updates?
I don't have any additional updates at this time.
Okay. Thank you. There was I'm going to move on to this C2578 study. And what this was a study on systemic complications of oral diseases among Medicaid beneficiaries with type 2 diabetes in Kentucky. The main thing on this was the background was the oral health is believed to be connected to certain pulmonary and cardiovascular diseases, suggesting that routine dental care may be beneficial for preventing these health complications. And I'm not going to read through all of it, but just I thought this was an interesting study to present to you all that, and it says, well, what did the study find? Well, the Kentucky Medicaid beneficiaries that had received prophylactic dental care, i.e. regular cleanings and exams, were significantly less likely to have a heart attack, develop pneumonia, chronic kidney disease, rheumatoid arthritis, or hepatitis C. And it says, based on the study findings, what policy solution can be suggested? This is that continuing to increase the supply of dentists in the Medicaid network should be a priority. And I know we've talked about this numerous times about the access to care. And I just feel like we need to get back to seeing what we can do to get dentists back into treating our Medicaid population. Personally, I'm just afraid that if we lose providers, I just don't know how quick we're going to be able to get them back. So I think that's a thing we all need to be working on, is getting our dentists back to treating our Medicaid population. And they were talking about just seeing the dentist, the overall improvement of oral health. It's associated with the reductions in the incidence of serious medical conditions. Placing a specific emphasis on expanding the suite of dental services covered by Medicaid in Kentucky may be a beneficial effect on rates of heart disease, lung disease, and other costly health problems. And I've just seen so many health study reports that, what goes in our mouth, it just has whether it be just food or excessive food or how we take care of our mouth and digestive processes has an effect on overall health. And I'm just glad, I just want to say I'm glad to see that Commissioner Lee is helping to direct, some additional benefits to our Medicaid population, and hopefully we can, just keep moving this on to where we get a better health status in Kentucky. I know one of the things that Commissioner Lee brought up at our Medicaid forum was that Kentucky was 49th in the nation on oral health care. And I just want to commend and say that I appreciate their efforts to help the TAC, help dentists to provide a better health outcomes. And I appreciate what the MCOs are doing for, just trying to get us, let's see if we can, maybe in a year or two, maybe get this moved up to 39th, or I don't think we can get to number one, but let's see what we can all do to, move this, I want to say, move the needle, to the other side of that spectrum. So any questions or comments on that study? All right. I put down just the TAC advisory functions and Commissioner Lee, or if you all have any things that please tell the TAC members, tell me, or I can spread the word that, we want to do what we're supposed to do. And I know sometimes you have told us that, even to think outside the box and let of some things. So all TAC members or anybody on our MCOs, if if there's something that we can work together on and get funding for, let's see if we can, let's see what we can do to move that needle the other way. And then I put a comment down there. It's like access to care. What are we doing? And I think one of the big things we can do is try to recruit back our dentists to, taking some Medicaid. And I know, according to Dr. McKee's report, the other day was, today and the other day was, the three main things was, the low fees, the failed appointments, and administrative burden were the three top things. So I've made a couple of comments today on just the one topic of root planing and cleanings and taking care of our diabetic patients. That's an avenue that maybe we could look at here in the future to start on looking at some changes to actually treat the disease. Don't do an initial treatment and then no follow-up on it. But is there any other new business? All right. Does any TAC member have any recommendation that we need to take before the MAC? I believe most of the questions that we've asked today, I believe can be handled just with a few emails to Commissioner Lee and some phone calls, or I think we can work out most of everything here. But is there any other recommendations that we need to bring up? All right. And when I make my reports to the MAC, even though we may not have a specific recommendation, I've been trying to, let them know at least what we've talked about and discussed, and obviously not go into this much detail. The chairman, she's pretty hard on us. She only gives us a couple minutes, so I'm just teasing. But on the agenda, I've got listed down the next MAC meeting, and our next TAC meeting will be February the 10th, 2023. One question, Commissioner Lee, are those fees for the new codes, have those already been sent out to the Medicaid dentists?
No, I don't think that, I'll have to double check on that. I don't think they have yet, but I'll double check on that for you.
One of the things too is I know it looks like we're gonna have a new dental school at Pikeville. And Commissioner, I believe that's your stomping grounds, isn't it?
It's close. I'm from Hazard, so it's
Yeah,
close.
yeah,
It's
yeah.
up in, not far, not far.
So maybe that will, and again, I don't have a lot of details about that. I do know that they have sent letters out to several of the dentists in that area to help be adjunct professors and clinic teachers. So I know that new school is going to be coming online. But there again, I think we just need to continue our network recruitment of dentists. We need, I said this years ago. I said, what kind of carrots are we putting out in front of the dentists? I know the Medicaid members get a lot of carrots offered to them, but we need to look at what kind of carrots can we offer the dentists to, ease their administrative burden, get a little fee increase going on, and just some basic help administratively. And I know Commissioner, is trying to look at these failed appointments. But I mean, these are just three main reasons why dentists are just frustrated. And I think if we let them know that we are working on these, maybe it'll take their blood pressure down a few notches. Anything else to come before the meeting? Well, I thank everybody for bearing with us. And when I was looking back at this agenda, I thought, oh, we're not going to get done on time. But everybody helped me get through it. So thanks to everybody. And I hope everybody has a great weekend. Thank you all.
Thank you. Happy
Thank you.
holidays. See you
Thank
next year.
Take care.
Bye-bye.
Thank you. Bye.
Everybody have a great weekend.
You too.